Well, it all started when I was a little girl. I fell on my grandma's porch and hit her concrete porch. And I started having problems shortly thereafter. And I've had convulsions ever since. All of a sudden I could be standing there and I would just drop. I would lose consciousness for a little bit. And I wouldn't be aware of what was going on.
Epilepsy is one of those things. It's kind of a high risk, a high gain area because the seizures can be it can cause a lot of problems with working and safety and other things. So they can be very limiting, if untreated.
I just had to live with it. But you get to a point that you get tired of falling down steps or getting a bruise here and there.
One of the things that we specialize in a center like ours is it's a bigger center. We have a big diagnostic unit set up for this. These represent our different rooms behind me here of where patients can be in the hospital. They can get a video and an EEG at the same time. And it's really the gold standard to make a diagnosis of epilepsy. For some patients that don't respond to medications, we can look for other treatments. And one of those treatments is the surgical treatment of epilepsy.
So he spoke with his colleagues, and I was a perfect candidate just because where my scar tissue was located in my brain for the surgery. And I felt very confident of having it done there.
One of the tricks of doing the surgery well is really finding exactly in the brain where the seizures are coming from. So you actually can take out that part of the brain without other problems overall, and you can cure the seizures sometimes.
He was very explicit as to what was going to happen, and he just told me that things can only get better.
Well, the care is so special here because the majority of our nurses are neurological nurses specifically. Each year we have what we call our competency training. And so we have refresher courses on how to recognize the seizures, what to do for the seizures when they happen as far as keeping the patient safe, and as far as being able to document how to medicate the patients for the seizures.
They really care about your outcome. You sense that.
We take time and we listen to their concerns, and the majority of them have some concerns when they come in about what their cure is going to be, if this is going to be successful. They have some fears about whether it will be successful or not. And I think that when you're compassionate and you take the time and listen to the patients and show that you care, I think that makes a huge difference with the patient and with their family members.
We also have a lot of expertise in neuroimaging, both for looking at blood flow studies related to seizures and looking at MRI changes and things along that line. We have a group of neurosurgeons with us. So to kind of have that comprehensive team to bring together, I think we're really the only center in the region that has that right now. The real goal is that this is a really treatable condition. And a lot of times there's a lot of possibilities that people don't know about.
And ever since then, I've had no problems for 14 and a half months. I feel normal. I really do. And boy, it's a big load off my shoulders.